Assalamu alaikum. So first of all, this is Dr. Shazia Hakim. I'm representing right now Dine College from Arizona, USA. First of all, I would like to thank Dr. Shahana Uruj Kazmi and all the team with Dr. Shahana Uruj Kazmi who were able to organize this very important conference. This is our 13th Biennial Conference of Pakistan Society for Microbiology, and I feel myself very privileged to be part of this crew from the beginning. I would like to just share with you all that the logo of Pakistan Society for Microbiology was basically made by one of my classmates, Farzana, and we were part of those first and second and then third biennial conferences of Pakistan Society for Microbiology. So this conference just remind me of all those days. So Dr. Shahana Uruj Kazmi is my PhD supervisor and one of the person who everyone like to follow, not only because of all these activities, but also because she is the one who basically introduced us to the world that how we can move forward in the field of science and how we can learn from our colleagues, from our seniors, from those who are doing great in this field. So thank you very much, Dr. Shahana, and we really owe a lot to her. Personally, what I want to discuss here today is that I know that majority of our colleagues and friends and the other experts who are joining this conference, many of them have been discussing COVID-19 associated different things. For example, the virus itself, for example, the vaccines, for example, the variety of measures we are taking care of, for example, that the different procedures that we have adopted to control and all these type of things. So my topic is a little bit different that you can see from here also. It is not about the virus itself. It is about the people around us who are facing this virus, who are facing this pandemic, who are trying to tackle this problem and help each other to control this problem. So what I'm going to discuss here is the COVID or Dikos Ntsaaígíí. That is a Navajo word that means cough that kills, and the indigenous population globally. Now you can say that why I choose this word. Okay, so this word I chose because right now the place that where I am located is under the control of Navajo Nation, which is the one of the biggest tribe of USA, and they covers, or they basically they are the area that is under the control of Navajo Nation is approximately as equal to more than 7 states of USA. So it is a very big land piece that they are covering, and it includes many parts of New Mexico, Colorado, Nevada, New Mexico, Colorado, Utah, and Arizona. So it is like famous as a Four Corners area, where if you have heard about hantavirus, so the first cases of USA in 1994, they were reported from this Four Corners area. So that is another reason why the Four Corners is famous, beside its location that all these 4 states, they unite in that, or they are merging at this point. So anyway, just talk about what we are going to discuss here. So how the COVID or this COVID-19 or the COVID pandemic or this coronavirus infection is affecting the indigenous populations globally, and how these populations are dealing with this virus globally. This is what I am going to talk about. So the main scenario that I am basically interested in is that we have seen when this pandemic started in late 2019 in November, when the few cases were observed in China, and then the first case we saw here in Seattle in January, on January 14th, I believe, in 2020. So what was the initial observations that the technologically advanced countries like USA, like Canada, like Brazil, there the people were dying at desperate rates, and why it was, nobody knows. There are a lot of things that were basically the hidden figures that we need to know, that were contributing towards the infection and the high ratios. Similarly, in some of the developing countries, we have seen that the conditions were more worse, both death-wise and both with the reference to the infectivity ratio. But on the other hand, if we look around some other advanced countries, for example, Australia, for example, New Zealand, what we see is that the total number of cases were very low. Total number of affected individuals were very low. Even the indigenous communities of those countries, they were almost 6 times less affected by this pandemic as compared to the other indigenous communities that are found in different advanced countries. So this was the scenario that basically evoke my intention towards that. What could be the possible reason behind this all? What are the basic reasons, basic points that we can consider behind this whole scenario when we are discussing with reference to the developing countries, when we are discussing with reference to the advanced countries, when we are discussing with reference to those countries that are somewhere in middle and they are trying to cope up with this whole situation. So from that point of view, this whole title came out, and I thought that, okay, because I'm living here right now in Navajo reservation, in Navajo Nation, and I have my own personal observation with reference to this all, that how these communities are dealing with this whole and how we can compare this whole situation with the situation there in, for example, in Pakistan. So this helped me to understand that what is something that is common, what is something that is all of these indigenous communities globally they are facing, and what is missing. So if you look around here, so I have just collected some of the pictures from variety of different places, okay, especially with reference to the indigenous communities of different countries. And what I would like you to observe is that try to find out what comes first thing in your mind after looking at these pictures. Okay, so for example, if this is Navajo Nation, USA, if this is Cree Nation, Canada, okay, then we have this our Tharparkar Sindh, Pakistan, Bangladesh, Eastern Africa. This is from KPK, Pakistan. This is from one of the rural village in UP, India. Then Gujarat, India, Nepal. This is another picture from Pakistan, and this is from Amazon tribe in Brazil. So all these pictures, if you see them, the first thing that will come to your mind is that they all are underserved. They do not have a lot of facilities available. Now, when we say facilities, what are those facilities? Basically, like everyone, what we need. The first basic need is food, water, okay, a place to live, okay. These are some of the very basic things that we need. And all these communities that you see around, the main thing that they are suffering is the water drought, the deficiency, the food and water insecurity. This is one of the important things that is common throughout the global communities, especially the throughout global rural communities, throughout global indigenous communities. Poor access to sanitation, Another very important issue, and this sanitation, if it is not proper, then we know that lot of diseases, lot of infections, they spread just because of the lack of proper sanitation. Inadequate medical services, if the infrastructure or the healthcare infrastructure is not good, if you are not having access to enough medical supplies, if you are not having enough medical support individuals, if you do not have healthcare allied healthcare individuals around you, you are not going to have enough of those healthcare facilities. The number of beds in the ICUs, in the normal general rooms, okay, so all these things are required. So are they available to these communities or not? So this is something that is missing definitely. Comparatively low literacy rate, another issue that is very common in all these communities, because everything comes from like how much you have. So the first thing that you will try to get is food and water, then the shelter, and then after that comes the literacy, the education. But if you do not have enough money, if you do not you have a sustainable economy, how you are going to spend more in your education? So this is something that is also missing here. Insufficient well equipped infrastructure, and then the communication gap, because we have the low literacy rate. So most of the indigenous communities, whatever the language they are using, whatever the indigenous language they are using, their elders mostly, they are only using that language, and they are not able to understand other languages. For example, if we talk about English, that is the one of the main language throughout the world that is used in terms of communication. So if you do not have understanding of some of the basic terminologies that we use with reference to the healthcare, just because of your lack of understanding with reference to the language, then again you are going to have a big communication gap. And this is another reason behind like some of the bad situations that we see with reference to this COVID-19. Okay, so these are some of the factors that are common everywhere in the world, and that you can see right away just by going there, just by looking at those pictures, that similarly as I shared here. So you can, just by looking at these pictures, that you can say, oh, these people are definitely suffering from these basic issues. But what are the hidden issues other than these basic issues that you can see? So all those hidden issues, if you see here, for example, higher rates of communicable and non-communicable diseases. Why? Again, low literacy, low poverty, high ratio of poverty, low communication, low communication gap, lack of infrastructure, and lack of like food, lack of enough water, sanitation, improper sanitation. All these things are going to result in this higher rate of communicable and non-communicable diseases, because so many times what happens that many of these diseases remains undiagnosed in these community members, and just because of the lack of facilities. And what happened actually is that not only one single person is affected, this disease they transmit to others also, and this is how the whole group of communities are going to be affected. And this indirectly is going to affect the overall mortality rates. It is going to affect the overall life expectancies. Okay, so malnutrition, undernutrition, genetic disorders, underlying health conditions, lack of rapid access to the quality healthcare and diagnostic facilities, lack of availability of the locally trained local workforce. This is another very important thing, because if you have the locally trained workforce, they will be able to communicate you, okay, especially with those individuals, those elderly who are present in these communities. They are not aware of the other languages. If we have these locally trained local workforce, they are able to communicate with them, and they can fill up this communication gap. So this is something that is also missing. Unavailability of information in the local languages. How many of us are trying to develop all these pamphlets, all these information guides in the local languages also? Mostly what we do, we use just couple of languages. For example, we have them in English, we have them in Urdu, we can have in some places we see in Sindhi, in Farsi also, but like not so many languages we are using for these translations. So this is another very important thing that we have to consider. And then the lack of trust on the authorities, and that is why we see even the polio, if you compare, that is still like polio has been eradicated from the whole world, but in Pakistan we still are having these cases. Why? This is the lack of trust on authorities, unavailability of funds and their appropriate utilization. So how the funds are generated, number one, and if the funds are available, whether they are allocated properly, whether they are utilized appropriately, this is another issue that most of these communities are facing. And then above all is the deficiency of appropriate or up-to-date data. Now, what does it mean? Because we do not have this data set available. We don't know exactly that how many of our individuals are affected by anything, how many of the right number of individuals are present in those or living in those communities, how many of them are really, like whatever the data is available through NADRA and other places, or similarly in other countries. So is that data is really 100% accurate or not? And because this data is very important, by using this data you can develop all the infrastructure, and this is what is missing in most of these indigenous communities. Urban locations, urban cities, the condition is quite different. They are able to develop all these data, they are able to track down the things, they are able to develop the infrastructure. And beside that, the economic conditions are also different in the urban cities. But like the most of these indigenous communities, they usually live in the rural areas, and that is why they are not availing all those facilities, all those plus is all those things that are available to them easily, that they can avail, they can utilize for the betterment of their families, for the betterment of their culture, like all the communities. So overall, if we see that this data set is very important, and why this data set is important, we see here these are the two things. The one is the risk assessment and the other one is the risk management. And between this risk assessment and management, this coinciding thing, or this common denominator, is this risk characterization. So how we are able to do this risk characterization? Basically, after finding out what different type of hazards are possibly present in those communities, how many of these individuals are going to be exposed to these hazards, how we are going to develop the treatment for those hazards, how we are going to control those hazards, all these things are dependent upon this risk characterization that is directly associated with the data. So if we have the exact data, if we have the accurate data set available about the exposure assessment, about the hazard identification, this will lead us for the proper decision making. But the problem here is that in most of these indigenous communities, the legal considerations are there, control options are there, because of the pressure that we are facing from different organizations, from different non-profit and other administrative organizations. So they are ready to do this all legal consideration, control options, they are ready to provide. There are lots of economic and social factors that they are trying to consider for the decision making. But the major thing that they are missing here is this risk characterization that cannot be accessed unless we will have the right data set available. And this right data set, this right risk characterization is something that will help us to determine the right needs of these communities. So this is something that is very important, and this is missing, and this is what we have to work on. So if really we want to work for the betterment of these indigenous communities. So if you see around that, if you forget for a while just your developing countries, if you look around, some other developing countries or developed countries just forget everything. Just look around the globe and you will see that after having this example from Australia, from New Zealand, what other indigenous communities started to follow. Okay, so one of the important thing that they were considering is that the impact of COVID-19 on their elders. Okay, it has the cultural implication of for their culture, for their communities. Why? Because these elders, they play a key role in keeping and transmitting the indigenous traditional knowledge, and the culture and the practices, including the conservation of the biodiversity, including the upholding traditions, customs, leading the community gatherings, ceremonies, and they basically serve as customary law and governance. Okay, so they need to preserve this. They don't want to lose these elders. And this is one of the important things that throughout the globe, all the indigenous communities, they started to look around that how we can save our elders, how we can save our culture, our traditional, because one elder die means like lot of these traditional values that are still need to be transferred to the next generation are gone. So to keep these important informations, to keep these all traditional knowledge, this traditional values and practices, to keep the culture alive, what they started to look around that how we can save our elders. So for example, in Australia, the government established a national indigenous task force to develop an emergency response plans for Aboriginal communities. Aboriginal means the indigenous communities of Australia, and they give charge to the members of these Aboriginal communities because they know what they need, and this is how they help these communities to get safe from this COVID-19. Okay, so what they did basically, they utilized many of their traditional knowledge and values and the cultural practices. Their medicinal men and women, they came forward and they helped to stop the spread of the infection in their communities. On the other hand, if you look around in Canada and in the US, the governments, they earmark the specific medical support, economic stimuluses were given to the indigenous communities, and this is something that I have personally observed here, that how the administrative individuals, those who are involved in the government and the different administrative positions, including the Navajo Nation president, they all went door to door to look around at what their elderly needs, what their youngsters need, what are the need of the communities, how they can help them by providing the food at their home, by helping them during the COVID infection. If somebody is infected, they should not have the need to come out of their house. Everything should be available at their doorstep. How they are going to help the kids, especially those who are doing the remote learning. So they should have the enough devices available. They should have the proper connection available, internet connection and everything. So just by providing all these facilities, so they can help their communities to fight with this monster. If you think other than these, Australia, Canada, or US, the current people of Thailand in Asia, and many other indigenous communities of, for example, Malaysia, Bangladesh, Latin America, Eastern Africa, what they did, they simply closed off the entry to their areas, okay, and following the voluntary isolation. So that way, basically what they did, they stopped the spread of the infection in their communities, because they basically stopped the incoming traffic. Nobody was allowed to enter their communities. They have practiced that very strictly, and as a result, the number of cases starts to go down. Okay, and they use all the recommended precautionary measures along with the increased healthcare facilities. They started to develop the healthcare facilities. They increased the number of beds, number of diagnostic facilities in their localities, and this is how they start to work on. Plus, they also start to train their local workforce to combat the infection, combat the situation, and to help reduce this communication gap. And that is the reason why these communities who initially were experiencing approximately 7 times more infectivity due to the COVID-19, now they are not facing that. They are having the cases, but the number is very low. And this is just because of the proper implication of all the things. And why they were able to do that? Because they have the right set of data. So although that data is not 100% accurate, but at least it was able to provide them the nearest possibilities that are required, that are needed, and how they can be availed. And similarly, if we can adopt the similar type of facility strategies in other countries also, we can definitely deal with this whole situation. So my question with you all is or question to all of you is this: what is the situation there in Pakistan? Are we experiencing, are we trying to follow the whole similar kind of precautionary measures or not? How we are dealing with this monster, especially in our rural communities, especially in our those communities where we do not have enough of these facilities? What we are doing to deal with this situation and the similar situation, because that might come in future, because the thing to consider is that this is not the end. Okay, we are living in a global village where all these different variety of infections are coming every day. Every day a new species is developing, every day a new variant is coming, every day a new organism is coming to known by our healthcare individuals. Okay, so they are going to stay with us, they are not going anywhere. The important thing is that we have to be vigilant. Important thing is that what the strategies, right strategies we have to develop to fight these things, how we are developing our communities, how we are protecting our elderly, how we are trying to increase this overall literacy rate among our individuals, how we are trying to develop the skill good and right skill set among our individuals so they can deal with any such type of condition very easily. Okay, and beside that all, the one and only important thing that we need right now to work on is the development of, or the collection of, proper data set about what we need, how many individuals we have in our communities, local communities, what type of infrastructure is missing, what is needed, what type of funds are available, how these funds are allocated, where they are going to be utilized, are we using every possible possibility that is available to us in an appropriate way, and how we are going to tackle with these all type of situations. The only thing that we can do is to train ourselves. Only thing that we can do is to learn from our mistakes. Only thing that we can do is to find out the way how to combat with all these type of healthcare issues and how to have a healthy and happy community. Okay, and this is what is the main thing that I wanted to address through this presentation. And thank you very much for giving me this opportunity and bringing this whole issue in front of all of you. And this is just a beginning to move forward, and I'm really very thankful for all of you to provide me this opportunity to discuss here. Please feel free to ask anything if you have in mind. Otherwise, like, thank you very much and have a good day. Thank you very much.